Hi, Dr. Stephanie Waggel here. Today I'm going to talk about mental health and plastic surgery. So I think that a lot of times when people hear mental health and plastic surgery together, they think about body dysmorphic disorder. But I want to differentiate between two main groups that, just for simplicity's sake, I want to divide into people who happen to have a mental health condition and are getting plastic surgery or an aesthetic procedure, and then the body dysmorphic, they're getting the procedure because of their mental health disorder. So the CDC estimates that 1 out of every 5 people, just in the general population, has a mental health diagnosis. So that would be in group 1 that I'm going to talk about. Is just, let's say that you have PTSD because you're at war and then you want to get your ears pinned back because they go out to the sides too much. Like, the two really don't have much to do with one another. So that would be like the group 1 I'm going to talk about. So group 2 is body dysmorphic. Like, they have an obsession about a specific flaw that they perceive. Usually the flaw is not perceptible to other people, and usually it's very subjective. Like, really they notice it and other people do not. So with the number 1 group, just general population, people that might have panic attacks or what have you, some things for them to think about whenever they get a procedure is talking to the doctor first to make sure that they're comfortable with everything, because whenever people try something new or they're undergoing a change, it's really helpful for anxiety preventing purposes to know what to expect and also to have a support person. So that would be a piece of advice for somebody. If their underlying condition is anxiety, that can be very helpful. Another thing is postpartum moms. So we live in this society where mom's supposed to embrace her postpartum body, but simultaneously we're getting messages from society as a whole and popular culture to look a very specific way. And so I don't think the two of those compete well or go well with one another, because you can't be happy with your postpartum body and then also have this idolized body of a person that's never had a baby before. So that's really difficult to really do both of those things. So I want to decrease the stigma. If you are not having body dysmorphic disorder and you just want to go get some Botox, you shouldn't feel ashamed to talk about it. Like, if it makes you feel better, like, go do it. People need to stop being so judgy. And another thing about the reduction of stigma is that a lot of times women, and especially moms, feel really bad or negative to go do anything nice for themselves, like facials, for example. So I write on my prescription pad, because sometimes it's just as important as taking a medication is to do something nice for yourself. So a lot of times when I ask people, like, when was the last time you did something nice for yourself? People are like, I have no idea. And then if they do answer, they'll say something like, I went to the gym a week ago. Like, that's like active and it is nice for yourself, but I mean like something relaxing. So I oftentimes write like have a facial or get a massage or things like that. So if you're going to a med spa, good for you if that's what you want to do and it makes you feel good about yourself. So forget about anybody else being judgy. And then another thing for group 1, the general population, people that just so happen to have a mental health condition, but they're not getting the procedure done as a result of the mental health condition. Another thing is just making sure they understand what it is that's going on, and they don't feel bad and they don't feel guilty, and they talk to the doctor, and that they understand what it is that is going to happen, and have a support person and stuff, and just make sure that they aren't like feeling guilt, because if I find that if I write it on a prescription, then they don't feel as bad because they're like, oh, the doctor told me that I had to do this. So that's for like the general population. The second, body dysmorphic. So these people shouldn't be getting these procedures in the first place, because 1, they're probably not going to be very happy with the results, because a lot of times the people that are doing them don't even like notice what it is. Like, they say that their nose is too big, and then usually the plastic surgeon will be able to pick up if their perception of their own face is not based in reality. But if they say their nose is too big, but it objectively is not, making it smaller, it really doesn't make sense. And they're not going to be happy with the outcome. But if they do get a procedure and they are happy with the outcome, they will find something else to hyperfixate on. And so getting these procedures done, if you have body dysmorphic disorder, isn't the solution. The solution is cognitive behavioral therapy and medications. The solution isn't tons and tons of surgery and tons of procedures, because you're always going to find and lock on to something new. And so another thing that I want to talk about besides body dysmorphia is selfie dysmorphia. So in 2017, the iPhone, they said it was an error, I don't know, actually put a beauty filter on the front-facing camera where people thought that that's actually what their face looked like, because you didn't have to actually go through filters and pick one. It just was automatically doing that. So people started to think that they looked a way that they actually didn't look. And TikTok, they have said that TikTok does this too with their live streams, is that it alters your appearance, but since you're not actively telling it to alter your appearance, you think that that is genuinely how you look. And that could definitely lead to dysmorphia and dissatisfaction with how you look in the mirror, because you get used to yourself looking a certain way on the camera, but then you look in the mirror and it's different and it bothers you. And so that's a big thing too, is that the filters, whether you put the filter on purpose or not, the filters are altering people's perceptions of themselves. Additionally, the American Society for Plastic Surgeons actually says that kids are getting plastic surgery, which it's like, you're not even done growing, my goodness gracious. And social media is making the kids want to get these procedures done. And they estimated that about 250,000 in 2018 got plastic surgery. And so it's really a big problem. So it's social media, comparing people to one another and that sort of thing. So you want to make sure that you're not going to get a procedure done because of a body dysmorphia or selfie dysmorphia or something. You want to go because you want to do something nice for yourself, or you want to just, get rid of some crow's feet, or you just want to take a break, or you want some peace and quiet, go to the med spa, relax. Don't feel bad. So make sure that you differentiate between item number one, which is just the general population. CDC says about 1 out of 5 people has a mental health condition, and that just so happens to be the case, and then they go get a procedure done at a med spa or something. But then group number 2 is they're getting it done because they have a mental health condition, body dysmorphia, or what have you. So let's not mix the two together. And then there's a third group that I want to talk about, and these are people that don't have a mental health condition, or at least it's not necessarily related to what's going on. They can either have congenital anomalies or they have accidents. So people, for example, born with cleft palate, like the kids that get the surgeries to fix that, they'll get teased less and feel better about going out. And it's just, overall a good thing for the kids, like Operation Smile and things like that, to fix like cleft palate, which kids are born with. And so that's an example of somebody getting a procedure done, not necessarily having anything to do with any mental health, that will have a benefit for them in the future. And another one is accidents. So if you're disfigured in an accident or you have burns, people can go and get procedures done to help them to either look more like their normal selves, or for all sorts of functional, physiologic, breathing, that sort of thing. So there's many reasons to get these procedures done. And if you want to go and get one done, and don't let anybody be judgy about it, is what I'm saying. And so just to recap, group 1, and this is just like I could obviously go into subgroups and things like that, but this is just a very superficial examination of what's going on here. So group 1 would be just general population, 20% of people just so happen to have a mental health condition, might not even be related to what's going on. They just want to go and get a eyebrow lift or something, and feel better about themselves or relax. And that's group 1. And group 2 is body dysmorphic. Maybe they've been staring at themselves with the beauty filter on and not knowing, and obsessing, and really hyperfixated on a certain thing that other people really don't even notice. And in that case, the procedure isn't gonna fix anything, so it's not recommended. And then of course there's the cases with the congenital anomalies where people are born with some sort of deformities or things that fixing could help them have a better quality of life. And then there's also people who have accidents, and getting certain procedures can help them return to their normal selves. So when you hear mental health and plastic surgery together, don't just jump that somebody has distorted perception or they're obsessed with their nose or things like that. So there's many different ways that mental health and plastic surgery and aesthetic procedures can be intertwined with one another.